Which of the following best describes the patient's condition? So this is going to be diagnostic. Um, I, the EEG kind of catches my eye here, right above. It says EEG reveals focal epileptiform discharges in the temporal lobe. So that's something that I'm kind of keeping in mind. So we have a 28-year-old woman presenting with episodes of unresponsiveness, lasting 1 to 2 minutes, followed by confusion. During these episodes, she's observed to stare blankly, engage in lip smacking, and perform repetitive hand movements. Okay, so because she's 28, we can cross out the absent seizures. Those are only in kids.
Okay.
It's just talking about unresponsiveness, and we do have some like lip smacking, but it's not really like muscle twitching, I wouldn't say. So it's definitely not a full-on tonic-clonic, so that can go out.
Okay.
She is losing consciousness, which means it's not simple. It would be, because simple means that you're not losing consciousness.
Okay, good.
So I'm gonna go complex partial.
Okay, let's go with that. Good, perfect. So I think you did this beautifully. Okay. One of the key things, right? First of all, let me ask you, do you know what focal epileptic form discharges in the temporal lobe is on an EEG?
Not like specifically focal, I know means, like a focal location, like they can zoom into there's specific activity in a certain area. And that
Sure.
area seems to be the temporal lobe. Epileptiform just sounds like epilepsy. So just some kind of seizure.
Sure. So
But that's
that's, I
pretty much
mean,
all I got.
yeah, that's practically what I mean, I don't definitely know 100%, right? But to break it down exactly kind of how you would say it, right? Focal, right, in one location, epileptiform, right? Probably kind of some seizure-like activity or seizure waves, probably, right? But definitely how you work through this is kind of the reason why I said beautiful is because, you're thinking on an kind of on a flow chart kind of ordeal, right? So you know that, loss of consciousness, I'm going to just do LC here because my handwriting is not good. So loss of consciousness versus, right, conscious, right, versus C, right? And loss of consciousness is that, you already said, right, loss of consciousness makes that what? Complex, right?
Yes.
Okay, makes that complex, right? Consciousness or didn't lose consciousness, right? That's simple. Okay, so already right? She's kind of not remembering, right? Unresponsive,
Mhm.
right? Meaning loss of consciousness. So you already know it's complex, right? So that helps you, right? You can get rid of the simple, right? And then also on top of that, right, you have focal versus general. So what does focal mean versus, what's the difference between focal versus generalized or partial versus generalized, right? So
Yeah.
focal is
So
kind of like your
focal is going to
partial.
be location, right?
Yeah. Yeah. So partial, right, is going to be kind of your focal location, meaning one lobe, right, is kind of how I remember it.
Mhm.
Right. Generalized or diffuse, right, is going to be both lobes, right? So they kind of tell you, one lobe, right, focal, right? So it's a partial seizure, and then it's complex because she loses consciousness. Perfect.
Yes.